Okay, everybody, we will go ahead and get started. Hello, bonjour. My name is Victoria. My pronouns are she and her, and I am your moderator for today's session. Welcome to Creative Solutions to Addressing Homelessness in Rural Canada. We'd like to begin by acknowledging that the 2025 National Conference on Ending Homelessness is taking place on unceded Indigenous lands. The Kanien'kehá:ka Nation is recognized as the custodians of the lands and waters in which we gather today. Ojibwe, Montreal is historically known as a gathering place for many First Nations. Today it's a home to diverse populations of Indigenous and other peoples. We respect the continued connections with the past, present, and future, and ongoing relationship with Indigenous and other peoples from coast to coast. I'd like to begin by welcoming our first presenter, Allison from Cape Breton University.
Hi, everyone. I'm really excited to be here today. I was supposed to be presenting, actually, one of my research assistants was supposed to be presenting, and this was Rebecca, and this was her fervent goal to be here as an individual who had exited out of homelessness just a few years before. And unfortunately, she did not make it today to be able to do that. We lost her in the summer. But this project was everything to her. And so I, hope very much I'm here today and will hopefully do it justice for her. So I am a professor in the Department of Social Work. I'm also, I come to social work from being a designer. I have a master's degree in architecture and a fine arts individual. And so what I'm going to be taking you through today is how do we do storytelling in a small rural community, which is Cape Breton, to disrupt homelessness-related stigma. I should say and start out actually that Cape Breton is also known, the traditional name is Unama'ki, which is the traditional ancestral territory of the Mi'kmaq people. But I myself am a transplant there. I moved there 2 years ago, maybe a little over 2 years ago I moved from Calgary, but I grew up on the traditional and unceded and stolen territory of the Okanagan Syilx people out under the colonial name of British Columbia. So I did grow up in a rural environment, but it was a very different one. And then I moved from urban to rural, and there have been a lot of findings for me along the way for this transition, some of which I will share. So I wanted to, because I'll admit, before I moved to Cape Breton, I knew it was in Nova Scotia. I didn't know very much about it. So for those of you in here who have that same kind of knowledge base as myself, Cape Breton it's essentially that island that you see right there with the little yellow marker on it. It is a 4.5-hour drive from Halifax, so from the largest regional, urban metropolis, is that what the Statistics Canada uses? We have no direct flights, there is no public transportation to Halifax, and the only direct flights we actually have to an urban area is Montreal and Toronto, and they leave at really terrible times of the day. So like the flight to Montreal is at 5 a.m. in the morning right now. So it's really difficult to access. And those of us who live in the CBRM, which is the Cape Breton regional municipality, there is some services, but there's not a lot. So for example, if you need anything specialized with medical, you got to go to Halifax. You have a heart attack, you get flown by a chopper to Halifax. So we do not have substantial access to services. There is one shelter on the entire island. And I believe it has 30-something spaces. So like many communities throughout Canada, Homelessness, visible homelessness, was really not a thing until COVID. So it's been over the last 5 years that it's increased. Between 2021 and 2024, our most recent service count around people experiencing homelessness had, over that 3-year period, that homelessness had increased by 72%. And of that, the overall population, 40% of individuals in that group are experiencing chronic homelessness. So that is quite a bit higher than chronic homelessness rates in other communities and across Canada. And stigma, this is something that I really learned moving to a rural community, is that the stigma in this region specifically is virulent. So because it is such a small community, everybody knows each other. I call Cape Breton the Who's Your Daddy network, because the first conversation you have with anyone is, who's your cousin, who's your daddy? Oh yeah, I know them, making the connections. And so once someone has experienced homelessness, they will be known forever in this community by everybody in the community as having experienced homelessness. And also our service count has indicated that the most, kind of the largest barrier to housing for individuals, other than lack of housing supply in this region, is that it's stigma around mental health, and that includes substance use. So this project emerged from a community housing workshop that took place in fall 2023, where it was clearly identified by community members, those with lived experience and those without, that the Cape Breton Regional Municipality would continue its necropolitical approach to homelessness if stigma wasn't addressed. And I'm going to show you on the next slide some of the ongoing stigma there that's occurring. So,
the community didn't want them there, they wouldn't be shipped here and put there. Guess what? They're not coming to them here. Ain't outrage.
So this was a community gathering in the winter of 2024, February. That is the premier, he's kind of cut off now, of Nova Scotia, Tim Houston, who was essentially yelled at by community members for 3 to 4 hours about how a new shelter was absolutely not coming to the community. There is also one of the big things that I learned about when I moved there is that housing, or money from the federal government, was actually rejected by the city council because they did not want supportive housing built in the community. So this is the level of stigma that is there. It's pretty awful. I've learned even more awful things of what's occurring there while working alongside the community there to change this. So this is a research project. I should say too, it's funded by a SSHRC Insight Development Grant, which I was really grateful for, that the funding agency was taking arts-based storytelling seriously and really thinking about how can we change stigma. So I'm not going to get into the nitty-gritty of the research design, but I want to focus on the sensory arts-based methods. So because this is what we use to work alongside the community to tell their stories and experiences of stigma. So sensory arts-based methods, I would argue that they're really effective, I think, and research and lived experience also indicates that they really evoke the felt experiences of storytelling. So it's about it's not just visual stories, but it allows audiences to emplace themselves in experiences and stories that are not their own. So that was really the impetus for doing the project in this way. And that sensory arts-based storytelling, it allows individuals to communicate their stories in a manner that is more closely aligned with how we all experience the world. It's embodied and sensorially immersed. So one of the methods that we used as the central cornerstone of this is cell films. So cell films are a participatory video storytelling methodology that allows people, it has to be filmed. I kind of actually explain it as TikToks. It's the academic approach before TikTok even existed. So it's essentially, we took research participants through this. And I should actually say, we had, when I first started out on this, I was really concerned that people wouldn't want to participate. But we actually had to go back to ethics and expand the number of individuals that could participate because there was such a desire amongst the community to share their experiences and their stories, which for me as a researcher really shows that this is actually an approach that community wants to participate in. So we did have to do, this is one of the kind of traditional ways or the traditional method around cell films, but we had a number of learnings that we had to adapt specifically to be working alongside and supporting this population. I would say almost all of whom, so we had 25 participants overall, and I think all of them were actively using substances during the project. So we had to think about just people needed like a little bit more bite-size time there. So we had, instead of a long workshop, we had hour-long workshops. We had it broken up. We did brainstorming. A big one was also that we just had a consistent place and days that people could drop in and continue to work on their project. So it wasn't like we're going to meet here for 3 hours and all of that. We were in the community center that people had identified that they were comfortable being in to make these. We also found that the storyboarding process, so kind of telling the story and figuring out the story that that individuals wanted to share, the traditional process wasn't really working. So what we did is, in between the first interview and then coming back to actually make the cell films, the research team created found poetry out of the transcripts. And so then we brought it back to the individual and said, this is what we heard. And that was actually really transformational, I think also in the relationship building, but also in the experience of the individuals, because they recognized that they were being witnessed, deeply heard, and having their stories reflected back to them. And it was also, almost across all the participants were kind of amazed that this was their words. They were like, what? I said that? Yes, this is your story. Like, you're such a powerful, articulate storyteller. So that was, and then they could be changed. So people would edit them and everything like that. And then we really did a lot of the heavy labor of the video editing. So we sat there, we did the editing, we went away, we brought it back. There were multiple, whatever individuals wanted, and there was a lot of changes. It wasn't, it was interesting thinking through the power hierarchy, but I think it went to that relationship building because people were really like, no, you totally got this wrong. Like, that doesn't go with this. We gotta do the story, gotta change the story. And then the final collaborative viewing was everything. The community building, the creating a group of advocacy together, a group of individuals around advocacy, thinking who needed to see these videos, and how we were going to share them in the community. It was, it was very powerful. So I think the next slide when I hit this, it's going to start playing. And this is our final video I'm going to share with you, and it's the collaborative thematic. So it's not the individual movies, but it is the final product of the thematic analysis and has the individual stories in it, portions of them thematically. I think it's gonna go. Or do I have to press play? Nope.
Medical misogyny is real. Whoever decided to call a woman's period the gift surely never had one. Female doctors are the worst. They're like, oh, I get a period too. So you gotta learn to live with it. I shouldn't be fucking disabled 2 weeks out of every month. I had a family doctor that was pretty okay. 8 surgeries later, hundreds of rounds of opiates. This was never something I would have picked up on my own. And then they just decided to cut me off. And that was the only thing that was giving me quality of life.
There's a lot of hateful people, judgmental people. I'm judged at Lawton's, I'm judged at Irving, and I'm hated at Sobeys, and judged at Kenny's Pizza. If you're homeless, you're no longer allowed to use the washroom. They think automatically that I'm in there to shoplift, that I'm going to be going in there to use drugs. I had a bad migraine one time. I was in there crying, pissing myself, throwing up, and the doctor, was annoyed with me. He didn't want to give me my shot. He didn't even want to turn the light off. Finally, he says, "Shut her up."
I've been there dying. I've seen people die. Waiting. You see all the nurses, doctors laughing, all in a big circle. The goings on up there to the people with substance abuse and homelessness is unreal abuse. Unreal abuse.
Downtown's the worst. Nobody wants me around. I don't take shit twice. That's why I drink. Well, drinking numbs the pain.
I'm clean right now, but people still follow me around. They don't understand. Why are you an addict? Look at them junkies. Why do I have to be buzzed into the bathroom? Because I have a book bag?
Check in with Emerge. They look at you. You're just drug seeking. Makes a person feel worse than they already feel. Move on. Move on. That could be the straw that breaks the camel's back.
So this is just a small piece of the project, and like I said, we have 25 individual films as well that go along with this. And so I have on here, it's already been submitted and planned for street art installations and some of the local film fests in Cape Breton, but also we're in agreement with the Cape Breton Regional Police to show this, and we're also working alongside, a lot of you saw the issues and the stigma. The number one place that we heard it was coming from was from the Cape Breton Regional Hospital. And so we are working with the hospital and with the nursing program at Cape Breton University, and also the new medical program that is starting there, and in our social work program to include this work in the curriculum, and to see where it goes from. This is a map I included because this was all of the places that this individual identified as having incredible levels of stigma that needed to see this work and hear these voices. So, thank you all. Okay, now can I? It's a complicated.
That's okay. I think we'll just click into
Okay,
it.
if you can.
We'll see. Okay. Thanks, Allison. We will do a Q&A period at the end. So for now, we will move to our next presentation. We're going to hear from Kabir and Sydney from the Rural Development Network. I think it's...
Let me just, it's a little bit.
Good morning, everyone. First off, I'm blown away by that. I think all of us here are left, it was incredibly powerful, the video that you shared, and just wanted to thank you, Allison, for sharing the work of your student. And I think we're all feeling that in the room right now. So please bear with us as we, try and talk a little bit about some tools and resources that we wanted to share with you all that are specifically designed for rural communities. But I'm looking forward to more discussion, and just want to give you a hug. I just wanted to start off and take a moment to acknowledge that unceded lands that we're standing upon today, the traditional territory of the Kanien'kehá:ka Nation. We also wanted to take a moment to acknowledge my personal home, as well as where our RDN's physical office is located, which is on Amiskwetisa, which is also known as Beaver Hills House or Edmonton. And this is on the traditional territories of Treaty 6, as well as Métis Nations District 9 and 10. Several years ago, our organization made an intentional commitment to reconciliation. As a non-Indigenous organization, I think it's really important to reaffirm my personal and our organization's commitment to reconciliation through our organization's homelessness and housing initiatives, as houselessness continues to disproportionately impact Indigenous peoples and nations across Turtle Island as a result of colonization. As a team, we really look to decolonize the way that data is collected through the development of culturally appropriate tools and resources in collaboration with Indigenous peoples and in alignment with OCAP principles. We commit to challenging existing and harmful systems, as well as seek new ways to decolonize the way that the Reaching Home program funding is administered. Now, just a little bit about who we are as an organization. So I'm just curious in the room here, who is familiar with our organization? Okay, so a few people. Well, that's great. And for those of you who aren't as familiar, so we are a national nonprofit organization that work across rural Canada. We do have a lot of our roots in Alberta because we were formerly the Alberta Rural Development Network a few years back, and we're really focused on community and social development. Actually, sorry, I'm jumping back. And so there's really 4 areas that we find ourselves working in. We create a lot of innovative tools and resources, including guides and toolkits, which you're going to learn a little bit more about today, as well as training, and we do this in partnership with rural communities. We provide a lot of research and really aim to help build capacity in rural communities to respond to various issues. We do a lot of advocacy and try and bring together folks across a variety of different networks and events that our organization hosts to just better share information on what's working and what's not. And then we also support groups with accessing funding through our housing and homelessness programs. I think it's also really important to note that our work has really evolved and really it really depends on what communities' interests and needs are. However, we do find ourselves working across these core initiatives. So we have our housing team that's specifically working on a lot of the pre-development work, which I'll let Kabir speak to more about today. We also have our homelessness team. We are the rural and remote Reaching Home community entity for rural remote communities in Alberta. We also serve through that funding First Nations communities on reserve, as well as Métis settlements. And our homelessness team, you'll hear a little bit more about some of the resources we have available to communities. We also have our rural immigration team who's really focused on supporting communities and welcoming newcomers into their communities. And then we do a lot of community engagement, community development work, and other spaces that are very much interconnected as well. So this is just kind of a summary of, again, some of the different areas that we work in. And in terms of why we're here today and what we're hoping you might be able to get out of our session is just to provide you with some, again, tools and resources that your community may be able to utilize. Maybe there's one tool that resonates a little bit more than another, and unfortunately, just due to time, we're not going to be able to dive into each resource in detail, but we certainly are keen to continue the conversation after today. It's actually the first year that our organization is hosting a booth at the conference, so feel free to stop by today as well if we don't get a chance to connect after today's session. And we're going to also share some examples of how communities are actually utilizing these tools, because I think that's really important to share as well. So one of the first projects we just wanted to give you some information on is our Shelter Pulse project. And I am going to just quickly shout out my lovely colleague, Mary, in the room here today. I'll just get her. She's front and center at the room here. Mary, this is her baby. She led and managed this project. It's an incredible tool and resource. I'll share a little bit more about it, and I'm going to show a video in just a second here. But if you have any questions about this project, I definitely encourage you to connect with Mary, and I know she'd love to answer any questions you might have. Oh, that's unfortunate. Sorry about that. It was a video on our end, but maybe just when it got sent. So that's no worries, but we will skip over the video today, and yeah, we can definitely share the video with you. It's just a little how-to and gives you a little bit of context on the project, but I can certainly do that as well. So Shelter Pulse essentially was a project that our organization did in partnership with the Mountain Rose Center. The Mountain Rose Center is a women's shelter based out of Rocky Mountain House, Alberta. They also provide a housing program. Usually they're able to attend this conference, but they weren't able to this year. They're an amazing partner of ours. And together and working with other shelter partners across the country, essentially a gap was identified, and recognizing that women's shelters so often there's capacity challenges, there's just higher priorities and needs that staff are responding to on a day-to-day basis. And so recognizing these needs and gaps, folks were reaching out asking for policy support. And that's where the idea with Mountain Rose, the Mountain Rose Center, emerged to develop essentially a database that would have policies and practices that could help guide rural women's shelters across Canada. So the project was completed. I believe the database became active in March of 2024, I want to say. And in total, there's 74 policies and procedures right now that were developed and informed through various policy review and feedback sessions with shelter partners. And to date, about 93 users are registered so far on the database, many of which represent gender-based violence organizations. However, there have been a number of organizations reaching out who operate, different types of shelters as well as housing programs that have been looking for policy support, and they've been able to really even use some of these policies as well as a foundation or a template to start from. So again, if you're interested in learning more about this project, I'm sorry about that. On my end, it's a different slide. Interesting. So that's a little bit about a policy project that we had on the go. And in terms of some of our data collection work, some folks in the room here may be familiar with our housing and service needs estimation program. So essentially back in 2017, our team was hearing from rural communities that the point-in-time count methodology was difficult to implement in smaller rural communities and didn't necessarily, or it struggled to capture that hidden homelessness population that we so often see in rural communities. And so our organization worked in partnership with a number of rural communities to develop this step-by-step guide to estimating rural homelessness. And this launched back in 2017. And it really aims to capture that hidden homelessness population, although I will say it focuses on folks along the entire spectrum of homelessness and housing insecurity. And so it's a comprehensive survey tool that's administered by local service providers and communities. It's available on our website, and in terms of when I had mentioned that it captures the entire spectrum of homelessness, so we ask questions to understand the experiences of folks who are experiencing unsheltered homelessness, who are experiencing who may have access to emergency shelter in a community where there was one available. We also ask questions about folks who are, again, who might be experiencing that hidden homelessness. We say provisionally accommodated, so folks who might be couch surfing. And we also ask questions about folks who are experiencing, who are at risk of experiencing homelessness. So folks who are that one missed rent payment away from becoming homeless, or maybe living in housing that is not suitable or appropriate, or is missing amenities and basic needs and basic human rights. And so with this, if you're interested in learning more about this tool, definitely connect with our team. So far, over 70 communities have been able to utilize this tool to gather data to better understand what housing insecurity looks like in their community, as well as what the service needs are, what the gaps are, and be able to then respond and address homelessness with this data. And then one thing I just really wanted to highlight with this particular tool that I think is really important is it really aims to amplify and elevate the voices of people with lived experience of housing insecurity in not only the data, but in the solutions to address housing insecurity. And then this is another data tool and project, our First Nations data collection project, and really it built off of the work of our housing and service needs estimation program. However, what we were hearing and learning as we built relationships with First Nations in Alberta was that we needed to look at ways to decolonize the way that houselessness data was being collected. And so we worked with 3 First Nations communities, our First Nations data collection team, who I'll introduce just shortly here, to look at how we could develop a culturally sensitive tool that would better capture and better reflect the needs and realities and priorities of First Nation communities. And I think it was incredibly important as a non-Indigenous organization to recognize for this project that it needed to be for Indigenous, by Indigenous, it needed to be Indigenous-led. And so we had a First Nations, it was a First Nations-led team who led this project. And I just wanted to take a moment to acknowledge Taylor, Tegan, Rochelle, Emile, Justin, Elder Marie, and the Indigenous Advisory Board for their guidance, their knowledge, their wisdom that ultimately guided the outcomes of this project. Many of the staff, this was a few years ago, have moved on from RDN today, but their work continues to have an impact in First Nations communities. So as I mentioned, the team had worked with 3 First Nation communities across Turtle Island, and community members really informed the First Nations data collection guide, as well as this storytelling tool, which really recognizes the importance of oral traditions and storytelling in Indigenous culture. And so the questions are asked using more of a storytelling methodology. They ask individuals to reflect on their journey, as well as just provide folks with more opportunities to share their story and experiences of houselessness. And it goes beyond just asking, those quantitative data collection questions and really focuses more on that qualitative storytelling. It also was really important for the team to adopt OCAP and promote Indigenous data sovereignty through this project, and so all communities have full control and access to their information and their data throughout this project and beyond. And so this tool is now available. You can find it on our website. Again, if you're interested in learning more, happy to connect. But really amazing what the team was able to accomplish through this project, and really excited to see the impact it will continue to have on First Nations communities. Oh. Okay. Perfect. So in terms of, that's again happening. I'm so sorry. It's going so well. Okay, well that's okay. You can just look at the picture, because this is great too. That's okay. Are you sure? Okay, thank you.
Change it. You just have to click on resume slideshow here.
Okay, resume.
And I think that usually work, yeah.
Oh, perfect. Okay,
So
now I know the trick.
again, yeah.
Thank you. Thank you very much. Perfect. So in terms of how communities are mobilizing these data collection tools, this is just over the last year, there have been 3 communities that we've been working with who have been able to successfully develop a housing and homelessness task force in their community, really bringing together various service providers across their communities to talk about homelessness and housing insecurity, for the first time. There have been 5 communities that really have been able to access funding as a result of this data to better respond to homelessness in their communities. There's 1 community that has been able to improve and expand on their support service offerings. And then there's been more than 15 communities that have continued in their efforts to respond to housing insecurity. And in terms of just some specific examples, I always like to provide Drayton Valley as an example. We've been working with them for a few years now, and they completed their first housing and service needs estimation, or not the first, but one of the first back in 2020. And based on the data that they gathered, they were able to identify a need in their community, successfully get the buy-in from council, and start talking about and having conversations around what an emergency shelter response could look like in the community. And they adopted a really innovative model. It's called the Shelter Pods model. It first emerged in another rural community in Alberta, and they adopted the similar model. And so they ended up receiving funding to purchase one of the trailers, and then they had another trailer donated by an organization in the community. And so in total, they have 12 shelter pods where folks can safely stay. It operates year-round. It's seen as more of a cost-effective way of providing emergency shelter in a smaller community when staffing costs for traditional MAP programs and shelters are so high. And then since then, they've been able to utilize data they collected back in 2023 through the estimation program to be able to advocate for funding for an outreach worker in their community. And they never had an outreach worker prior to this, from my understanding, outside of some short-term contracts here and there. And so it's that outreach worker is really complementing the emergency shelter response in the community, and they're doing incredible work, and their council continues to be very supportive of responding to homelessness in the community, which is incredible. And I know they presented last year at CAH. If you're interested in connecting, I'm happy to make that connection, but they have been so generous, not only Lola Strand, who's overseen the program from the town, but their council and mayor have been really supportive and have invited other communities who might be having challenges getting their councils on board to engage and have conversations with them. So just throwing that out there in case there's some interest there. And then if you had the opportunity to attend the rural and remote session yesterday, you would have learned more about Homelessness Society of the Bow Valley. They're an organization based in the Bow Valley, and Jessica Cleric, their executive director, shared a lot about their winter shelter program yesterday, so I won't go into too much detail, but the data, again, they've really highlighted has been critical for them, and being able to initially get, again, the buy-in from the town to start and pilot the REST program back in 2020, and they've been now operating a shelter for the last 5 years in the community as a result. And then in terms of a housing example, Soaring Eagle Society is an organization based out of Whitecourt, Alberta. They're providing transitional housing out of a motel. And they've been doing incredible work. They're currently housing about 31 residents right now at a time. And I just wanted to provide this as another example of just solutions and the great work that is going on in rural communities. I think so often, and I totally get it, I find myself doing this too, but we focus on, what's not going well and some of the challenges. But it's incredible to see how communities are able to really push the work forward despite some of these challenges, and be able to have such a huge impact on housing folks in their community. And then just lastly, I just wanted to talk about coordinated access, which I know can be a hot topic, and especially when it comes to rural communities. I know when we've had conversations, often folks will ask, like, I don't know, or maybe they're a little hesitant, or maybe they've never heard of what coordinated access is. And then when we get talking about it, and we learn, they have an interagency group that meets, or, they have maybe a referral system in place, then we start to, break down really what coordinated access is. And we often see in rural communities, it's happening on an informal, basis. And so our team, we ended up receiving some funding a couple years ago to develop a guide to implementing coordinated access in smaller communities. And really, we wanted the guide to be like a bottom-up approach, not a top-down approach. We didn't want it to be a technical guide. We wanted it to be a capacity-building tool and resource. CAH can provide a lot of that technical support when it comes to coordinated access. And what we were hearing from rural communities was, they didn't necessarily know where to start, or, they really wanted to build that capacity before taking those next steps. And so that's really where this guide comes in. And over a couple years, we worked with it was about 100 service providers, 80 folks with lived experience, to really inform the development of this guide. And I do want to thank Grey and Bruce County, Cochrane, Ontario, as well as Hinton Adult Learning Society in Alberta, who were incredible partners for the engagement on the project. And again, it was crucial for informing this guide. And we actually had the opportunity to bring together, it was about 60 service providers from across Turtle Island. It was February of 2024. It was an incredible few days just to start to have conversations around coordinated access, but it also encompassed a variety of other topics, including, burnout across the sector. And it was just a really meaningful few days that I think our team and folks really enjoyed. So that's a little picture up there, of us. And then just lastly, I just wanted to highlight one more community example. Camrose is another community in Alberta, and it's been really cool to see their evolution over the last few years. And, initially, outside of course, the service providers focused on supporting folks responding to homelessness, it wasn't really being talked about in the community. Then came the opportunity, once the conversation started happening, to do some data collection. So they participated in a provincial-wide estimation, got some data to identify what the needs and the gaps were, and then they moved forward with developing their housing and homelessness task force, which we supported with initially, but they have since taken and run with it and are continuing to meet on a regular basis, which is phenomenal, really looking at concrete solutions and next steps. And we just found out actually just last week that they were able to hire a housing navigator, which is really exciting. And now they're starting to explore what coordinated service delivery could look like in their communities. So it's really neat to see the evolution in some of the communities. And we're an organization that's not frontline. And so we see ourselves as being a support to frontline service providers, which I know a lot of you are in the room here. And so if there's, like I said, we're here to support you. So if there's ways that we can better support or challenges that you're dealing with that, even if it's not our organization, folks that we can connect you to, we're just happy to support in any way that we can. So with that being said, I'm going to pass it over to Kabir now, who's going to talk about some of our housing resources. And just thank you so much for your time today.
Thank you, Sydney, for that presentation. I promise there's only maybe 5 minutes left and then everyone can go for lunch. I'll run through this pretty quickly. I'm going to talk about the Sustainable Housing Initiative, which is kind of like an arm of the Rural Development Network. It's something that we was really created to just kind of address the housing crisis in Canada. And a lot of the work we do is with rural, remote, and Indigenous communities across Canada. So I'll just go into a few of the projects that we're currently working on, and then I'll talk a little bit about the other type of work we do. So one project that I really wanted to highlight is the Chinook Foundation. So the Chinook Foundation is located in southern Alberta, in Cardston, Alberta, which is kind of I would say south of Calgary, really on the border with the U.S. So they'd been affected quite a bit recently, and even before they were kind of not usually funded for housing projects due to their population size, right? But there's a lot of people who are experiencing homelessness, and there's a lot of people who are living in unaffordable housing. So the Chinook Foundation kind of works to address that. And this specific housing project that they were looking at was for seniors. They wanted to fund a retrofit of their building, and they're still working on that. And they also want to develop new affordable housing as well for people in the community. What we did was we kind of took them through the pre-development phase from start to finish. So we worked with them to kind of speak to the Federation of Canadian Municipalities, who had a funding program for certain pre-development activities. So we helped them do that, and it was a good way to really discover what they would need to do to move forward with their housing development. Through that, we ended up doing a housing needs assessment with them, and this was super interesting because with the housing needs assessment, you're kind of looking at the need and demand of the community. And in small communities, you're very limited in terms of statistics, just because some of these population centers, they're under 10,000 people. So there's a lot of data suppression. And then, a lot of the data that we were using is from the previous census, so it is a little bit outdated as well. So we did a housing needs assessment, which was pretty cool. And another thing too, before I go into more of the weeds on this, the housing needs assessment is usually something that's required from funders to get funding for big projects. And a lot of rural communities miss out on those big projects because they don't, like, the needs assessments are not already done, right? They have to take it upon themselves to go and do the housing needs assessment, as opposed to like a bigger city that might already have one. So we did that. We also worked with them on a community consultation. So that was pretty cool because we were able to really meet with people in the community and see what they were experiencing and also what they wanted for their community. And you'd think like people didn't really want more affordable housing. You'd think there's a lot of NIMBYism. But our surveys actually they had pretty good responses. Like, people recognized, the issues. They recognized that they weren't really receiving much of the funding that was being announced federally and even provincially in Alberta. So that was really interesting. So we got all these different perspectives, and we were able to write a What We Heard report, which will also supplement their needs assessment when they want to go for funding for like a bigger project. And then we ended up doing an affordable housing strategy with that data, which was kind of cool. Like, we did recommendations from that, and the recommendations were really talking about, how to best really have housing that serves the people who are living there, right? What kind of services to offer, how to really navigate all of the housing in that community, and how to kind of get buy-in from community members. So that's another document we developed. And then the lessons learned is really like not to go into projects with too many preconceptions. Like, we think, a lot of people would think a smaller town, they don't really want new buildings. They don't want to do housing that's multi-unit, like missing middle type of housing, right? But that was not really what we saw in what we in our surveys. So that's a good lesson that we learned. Excuse me. But yeah, it was nice to go from start to finish on this process and to really have the data now that can really demonstrate that there is housing need in this community. Because people in small communities, right, there's housing need in your community, but it's really hard to prove that and to really explain to people that there is a need because there's nothing on paper, right? So this will be really good for that whole area of Southern Alberta to really demonstrate that. Another project, and this was also only in Alberta, this is called the Enabling Housing Choice Project. So this was funded by the Alberta Real Estate Foundation. So it was really focused on a few communities in Alberta. And it was to understand the barriers to housing development. So this was interesting because we were able to speak with people who have a stake in housing development. So we had like developers, we had people who worked in town council, community members, influential figures, right, in these communities who we interviewed, and they really talked about what the barriers were to housing development, the successes, things like that. Whether Housing Accelerator Fund money has really has benefited them, or whether they haven't seen a difference in movements from the municipal side of things. So that report finished up, and that's available on our website. And now there's a guide for diversifying housing in rural communities. And when we say housing diversity, we mean housing that is that kind of fits into that missing middle housing. So if you don't really know what missing middle is, it's kind of like you're in Montreal. Like, you look at all the housing in the neighborhoods and how everything is dense, and you have multi-unit triplexes, you have duplexes, things like that. It's kind of a mix between like a duplex and then something below. I believe it's like a sixplex or a fiveplex. So it's meant to increase density, increase walkability, just kind of, I guess, like build a better type of community So we're trying to look at that in rural communities, because again, you don't really think like in rural communities, people would want to have missing middle housing, but it's very interesting because people do. So that's kind of a myth that we were able to really dispel in this report. And now we're also working with four new Northern Alberta communities, and it's going to be interesting because in the north, things are done differently. Like in Northern Alberta, there's access to materials, access to labor. So it'll be really interesting to see what people say on the development side for that project, and that should be wrapped up probably in late 2026. So maybe in a year. So that will be ready then. And then I just want to kind of wrap up with the other community work that we've been doing. So really, like at the Sustainable Housing Initiative, we do research projects. We have a step-by-step guide to developing affordable housing that's available on our website. We work with communities across Canada. I just shared these ones. These are in Alberta, but they were, I guess, the most recent ones that we worked in. And we do housing and service needs estimations. We do housing need and demand assessments as well. We do community engagement and community consultation, and since COVID, we've also been doing a lot of consultations virtually through surveys and through other means, and we've actually found that we get a good response on those as well as the in-person. Excuse me. And we do affordable housing strategies too. So these are the most interesting because you get something different than the usual housing needs assessment, something that's more interesting to read. And then we also work with communities to access funding for their projects. So whether that be federal funding or provincial funding or even funding from other types of sectors, we kind of help them with capacity building and really to look for how they can fund a project. And then we do a lot of different training programs. And we have another initiative as well that is called the Rural Immigration Initiative. So they work with newcomers and they work with employers of newcomers, and they provide a lot of training programs on how to best kind of integrate people into smaller communities, new immigrants especially. So that's very interesting. And at the end of the day, it's all tied into the housing space. So it's really nice to tie all these things in together. And and then that's the end of our presentation. Thank you so much for hanging in there. And we'll take questions after when the moderator comes. Thanks.
Okay, great. Thank you so much to our presenters today. Those were some great presentations. Does anybody have any questions for our presenters? Okay, perhaps I will ask a question then. My first question would be for Allison. Obviously, one of the major things that your project was looking at was stigma. I'm curious what the response has been to your sort of public showings of the art. You mentioned doing some street art installations. So I'm just curious sort of what that response has been, and if you feel there's been an impact on the level of stigma that folks are experiencing as a result. Are these microphones on?
I also have a very loud voice, so it's fine. So far they've only been shown to, I would say, people who are already allies. We're working with the community strategy across the different sectors. So we're working with public health, we're working, like I said, with individuals at the university in charge of programs. So it's kind of a wait and see. I think I would actually like to turn that around and ask, this is actually the first time I've shown the thematic video to anybody. So you're at the world premiere of it. And so I would actually love to hear from you in the audience as to whether if there are any things that you think could be improved upon, or if you think, I realize we're all here at the conference, so we're already, it's a bit of, we all, I think, are already empathetic to this, but do you think that this type of lived experience storytelling will have an impact on community members? That's the second part of the project, is we're going to evaluate it. But yeah, if anyone has any ideas or willingness to share it, yes.
Yep.
Hi there. I just wanted to comment, and what I was seeing from your showing of the art was it did a couple of things. One, it gave voice to those who are voiceless, and it also made visible those who are invisible. How many times do people walk by the homeless on the street without even looking at them?
Yeah.
We're neglecting the humanity.
Yeah.
So just wanted to comment. Thank you.
Well, thank you for that. That is one of the intentions of it. These individuals in Cape Breton are excluded from all public conversations. Yeah. Yes.
Better to go this way or that way.
Should I bring
just wanted to say in the econ we had a lived experience, voices influencing change, and from that experience, having multiple people with lived experience on a panel, giving voices out. There's been a lot of, oh, thank you. Hello. Oh, that's a little scary. There's been a lot of change in terms of where people with lived experience are now. So there's a lot more engagement on having people with lived experience on panels, involved with government, involved with big changes in the community. So it's a small step, and it's taken many years. But it also is making an impact. We're making sure to have a lot more marginalized people on boards. Our communities have a big community action plan for preventing homelessness, and one of the big things was creating a coordinated access guide. Throughout this guide, we're having the stories of people with lived experience throughout the guide, so that anybody who's using it is also going to hear, what does this impact? When you do this step, what does it feel like? When you do this step, how did it impact somebody from their voices? So it's amazing, and small steps, big change. Good job.
Thank you for sharing that. But I'm gonna look up voices influencing change.
I'll send it to you.
Okay, great. Thank you.
Hi. So back to your question as to how it could be improved or whichever. So I work for social development as a homelessness strategy consultant in northern New Brunswick. And I've only been in this role since May. My first week of work was actually the CAB summit in Moncton. And as you were walking in, there were large pictures of some of the homeless folks around town and some of the outreach folks, and you could sort of scan a QR code and then hear their stories. And having kind of been new to the field or so on, I felt the impact of that. And I was kind of thinking we need something similar, where I'm operating for kind of awareness and bringing sort of the humanity to the issue. And so I guess my thought is you've done something great. I would love to kind of have similar things for the North, and it's kind of a daunting task to undertake, where some of the work has already been done on your end. There is currently a University of Moncton study being done for the Acadian Peninsula, trying to analyze homelessness there and what some of the solutions might be. It could be interesting to kind of plan how that's then communicated to the population. Is it just a boring presentation, or does it include some art and led by the folks experiencing it? So I thought maybe it could be within partnerships, or learning from, or maybe borrowing resources, or taking the moment to have a large impact, because I do think it's there's lots to that approach, and you're doing it well. It's just kind of maybe expanding it for the moment to have a broader impact.
Thank you for that. I was going to say one of the challenges of this too is I think having worked in this sector for a while, it can be, like, as you said, daunting, right? So I would also like to say, if there's anyone in the room who does want to, partner and think about this type of arts-based storytelling, this is my jam. So please connect with me, and I would absolutely, this is like, I have a lot of research projects, and I will say this one is my favorite. So, yeah.
Hi there. So first off, I want to commend you and I want to commend the project. I'm from a small rural community in Manitoba, 5,000 people. It's an agricultural community. We are facing very similar issues in our community, and it's our town council and it's the governing bodies that either they have another agenda, or because it's more prevalent, it's more aware, it's more in your face in the smaller communities. So if you find a way to kind of get through to them, definitely put it out there, share it with us. I know we're doing an information session in our community in December because there was a really nasty town hall meeting that took place back in October. And what's happening is they're highlighting issues. They're not highlighting the individuals, so instead of it being the homelessness, they're talking about the harm reduction. They're talking about needles, They're not focusing on the fact that these are people that are trying to survive on the street. So all these other issues are foreshadowing or covering up what's actually going on. So that's what we're trying to kind of clear the waters a little bit and get them to focus on what the actual issue is.
Yeah, thank you. It's I'm trying to figure out, as a social worker and like an arts-based activist, I'm a bit of a shit disturber. So if we have one of the art installations, for example, is we have like an outdoor, essentially, projection system, and we're going to be projecting this onto the front of the municipal building before the city council meeting, because if they don't allow us to come in and do this, we will force them to listen to this. So I am a big believer in arts-based activism. So, yeah, if you want to, I'll bring my portable projector to any community as well. Yeah.
Hi there. This is for Sydney and Kabir. How did you start the Housing and Homelessness Task Force, and who did you invite to the table? Yeah. So someone from a rural community, a lot of the people are at the grassroots. They're already sitting on committees and boards. Like, how do you get them engaged and motivated?
Really great question. Testing? Yep. Perfect. Okay, thank you. Really great question. And Mary actually also focused on that particular project that I was referencing with Camrose. But in terms of just generally what we're seeing, in terms of, the discussion around who should be at the table, a lot of the times the service providers that are engaging us in this work are, in Alberta, it's FCSS, so Family, Community and Support Services, or, other service providers in the community that are serving folks experiencing housing insecurity that will approach us with some of the similar challenges and, narratives that we're talking about today. And so typically we start off with having a discussion with them, like, do you have an interagency meeting? Who's maybe missing from that table? Is there anybody we have a conversation with them in terms of what their kind of goals and hopes and ambitions are. And we also obviously try and get a sense of what they're experiencing in terms of their council and council members and mayor, and in terms of support, or maybe there isn't support at the time for the project. And then it's making sure there is representation from all of those appropriate, actors. I like to use the word actors in the community. We've seen some really interesting non-traditional partners who have been invited to the table over the years as well, like folks you wouldn't necessarily think of. Like, libraries right now are becoming, we know they're a huge community hub in smaller communities, but libraries are now reaching out on all levels, we're finding, and have been instrumental and have had a huge voice at the Homelessness and Housing Task Force meetings. Of course, RCMP, in Alberta, it's Alberta Health Services, nursing, if there are mental health supports in their community, even school representation, local businesses. The list goes on. There really isn't, I wish I could have like a set plan to give you today, but I think it's it's something that we have a conversation with the community to decide.
Okay, just in follow-up to that, like you mentioned health and you mentioned education and everything like that, how do we get those, the policymakers and the leadership to say, hey, yes, I do want to put my staff on that task force?
Yeah, no, great question. I think it really, and I know, this is probably an answer that you've heard before, but I think it's really about building that relationship. It's not necessarily going to happen overnight, getting that buy-in right off the bat, but developing that relationship, saying, hey, are you free for coffee? I would just love to chat with you about, a project we're working on, or I'd love to get, make sure you have a seat at that table, because I think it's really important to understand where everybody has different priorities, right? And the more we can understand, others' priorities and kind of what's going on in their head, and the better that we can build that relationship. And then hopefully at one point, they will be ready and interested in being a part of something. And I think, but it is, I'll be honest, it doesn't necessarily happen overnight with every single person. But also too, I think not being afraid to if it's, you have to make sure the right people are being invited to this table. We had this conversation actually yesterday in a bit of a group. And maybe that is, nominating someone else to sit on the task force. We also recognize that a lot of times folks will have many different obligations and responsibilities. Maybe they're sitting on many committees and you want them to be committed, right? So also that's a consideration I would just note, but happy to chat further to better understand your local context too, because I think that's really, critical. But hopefully that helps. And I'm not sure, Kabir, if you'd add anything on that front.
I don't really have anything to add. Those were great answers. But yeah, it's about building buy-in, right? It's about meeting with people and talking with them, and then really kind of having buy-in through that, I would say.
Mary wants to add something.
I think too with the Camrose Housing Task Force, what was really important is supporting them in developing a governance model of how things are going to run in the moment while we're managing it, supporting them with it. But then also, I also have a loud voice, and also once we move on. And so who's going to be responsible for chairing those meetings and making sure there's lots of great representation around the table, and how to recruit and retain that, and literally coming up with the governance overview or guidance. I know there's actually a term for it, and I don't know why it's escaping me. It's a very well-known term.
Terms of reference?
Thank you. Terms of reference is super important. It always seems like such a tedious part of the overall design of something like this, but it certainly helps guide those communications, and to bring folks to the table that should have a voice, like the policymakers and what have you, and have who have that level of influence. So, yeah.
So are you recommended to have those already in place before you're trying to engage?
I think that it's important to do it together, as once you establish a group, and there's nothing that stops Housing Task Force from adding people after it's already starting to gain some momentum and you start to establish some of those things, right? So maybe the policy makers aren't there right away, but once they hear about a collective and about the conversations you're having and you start chatting with them about it, that might be what is going to influence them to come to the table, especially if you lead it by saying, we think your voice is important here. Let me tell you about what we're already talking about. You know what I mean? So.
It's just in rural communities, we're just struggling with the engagement
Yeah.
piece of it, because people are burnt out and you're not really getting anywhere.
Yeah.
And there's just not that level of engagement that needs to be, because people, have so many other responsibilities to take care of. And so this is where I'm trying to figure out, okay, what's a unique way that we can approach our community and say, hey, we need this task force on board? Because in Dauphin, where I live, we've had task forces. We have the community advisory board. We have interagency there. But again, we're all talking to the same people about the same problems, and 8 years later, we ain't getting, we ain't getting better. So I'm just wondering, what's working? Because I'm seeing in other provinces the successes and the programs that are working. and it's not working for us. What are we doing wrong? Thank you, everyone.
Yeah. And I think too, sorry. Anyway, I'll even sing a song for everyone. But I think that it is possible that those templates might not work for your community, right? And so what would, through consensus and maybe it just starts off with 2 people who have the capacity and want to have the conversation. And then it unfolds from there. Maybe it is 3 people make the meeting one day, 5 people the next time, and I think, the more you could really make it work for your community and move away, because all those templates, all those other things that you see other communities doing and they're being successful at, it's not always going to read in your community. So be open to that as well.
And if you don't mind, I just might add as well, thank you so much, Mary. I think, and for sure feel your frustration, just please know you're not alone. We work with communities who feel the exact same way. I think, of course, I just lost my train of thought, but of course. We're talking about, folks can feel really overwhelmed, especially when there's so many competing priorities. And I think that's one thing as well that we did with Camrose was we did a lot of workshopping around what are the key priorities, what's realistic within a year timeline, what do you want to focus on first? Because if there's so many things you're talking about at the meetings, it can be really overwhelming to know where to start. And that's where I think there starts to feel like, okay, we're not moving and any trajectory, nothing's getting done. Like, what's the point of these meetings? Why am I here, right? So I think that's just one other thing that I wanted to add is really focusing in on what, and we're working or having conversations right now with another task force where they're in that exact boat. They're like, we want to actually do something now, but our list is like 100 things. So how do we narrow down what we're going to focus on and prioritize as well?
Is this on? Hi, I'm Carrie, and I work with a CE with Reaching Home for Manitoba, because I heard you said you do that. It is quite frustrating working with Reaching Home, because there's strict guidelines of what they say and what we see are totally different. Keep trying though, because I tried about 2 years ago where they wouldn't fund tents and stuff like that. Well, it's in Reaching Home now because I fought for that. So change is slow, and I'm an instant person. Let's do it now. But there's 3 of us that work with one organization, and we've had lots and lots of meetings about how we can expand and hit that gray area and make things work better. So what we've done, we've started last year. Like all 3 streams have kind of started last year, and it's working. And it's for like that small town, that lady from I need to talk to you. Because what we're doing is and we're hearing it from other communities too, saying we don't want this, we don't want this. So we're actually working towards an organization in purchasing a house. Because we can fund paying for the house, we can fund paying for renovations. And then you can, as long as you can run it and show your community that, yep, this is working, I think it'll expand from that. I do that I do the Indigenous funding stream. So I've been doing that with small towns, and we're seeing successes. Because then I can actually get that data too to show that, yeah, this is working. So I want to encourage, I can only speak to Manitoba, but I want to give you, we're having a call for proposals coming out right away. I want your email because I want you to apply for it. And that's an angle we're trying to work on to see and I think it is working. It's slow, but it is working.
Thank you for the video. That was great. About 10 years ago, I'm from rural BC in the Kootenays, and we did a photo voice project where we gave cameras out to everybody that was living on the streets, and they took pictures of, this is the staircase where I could find to stay dry. Here's the bench I sat, or the chair I sat at Emerge for 12 hours while everybody else was getting let in. here's families going into the library. I haven't seen my family in years. So it was really impactful, and there were tears in the house, and it is still to this day, moves people. But what we're talking a lot about within the different communities and here and everywhere I go is there's a real compassion fatigue kind of taking over communities right now. So we had champions 10 years ago that are still on the same boards, going to the same things. And I get the whole, well, we're on this board and that board, and you see the same people on the supportive housing board and the homelessness, all of these different meetings that are happening that are not getting any traction. And I think, I'm only still working because I still believe that there's a solution or that there is some movement going to be made. But a lot of the board members are falling off, and you don't have the champions anymore. And like I said, we're seeing a lot of community fatigue. Whereas before they were building places for people to go in our community, they just ripped down a gazebo and a pier overlooking the river because people were congregating there and they don't want to see them, so they ripped them out. Very media-wise, it was heartbreaking because it just ramped up the stigma, and now they're open season again. It's like those people wrecked all these nice things that we used to have. So that wouldn't have happened 10 years ago. That wouldn't happen 20 years ago because people didn't have the fatigue they have now, but people are getting tired and with what's going on. So yeah, you're kind of fighting an uphill battle, but it's definitely worth it. But you can see the change in the communities all over.
Yeah, thank you for that. I think a lot about this as a social work researcher, and I think we also are underestimating it's the compassion fatigue, definitely, and there's also a lack of understanding that we, as a world, I think, are walking around with trauma brains from COVID still. We just decided to, leave it behind, pretend it hasn't impacted us in our mind bodies. There's increasing anger, everything else like that since, in particularly over the last 5 years. So, yeah.
Okay, we will take one more question.
I know everyone wants to get going for lunch, so I'll make it quick. Really enjoyed the presentation today, going to the arts and story sharing. I'm a person from a really small rural town in Ontario. I work for a health team as a peer coordinator now. When sharing the stories can be really hard in small communities, so I like how it was done kind of anonymously. A couple of years ago in our small town, we held an event, and it was called Hope Talks. So it was giving people hope. And there's people of lived experience, myself included. I have many stories of lived experience. I shared mine. A whole bunch of other people in our communities that were success stories, I guess, of lived experience, sharing their stories. Huge influencers in our communities. It's kind of a knockoff of the TED Talks. And it really helped with the stigma because our community could actually recognize the real people that are living in their communities and telling their stories of how they had struggles, whether it was through substance use, through housing, things like that. But real people, real stories, and it was really powerful. And I was surprised there were several people that were well known in our communities that stepped up, and afterwards the stories that came out among the other people in the community saying, hey, that happened to me, or I know somebody that's happened to. I just wanted to share that, but the Hope Talks, but I really love the idea of people able to be doing it anonymously too through a video or whatnot. So thank you very much for all that.
No, thank you so much. I wrote that down, Hope Talks. That's excellent, thank you.
All right, thank you all so much for attending. So we welcome you to join us now for lunch. Thanks.